You're listening to a special presentation of the Greg Tish Show, Monday through Friday, 6 to 9 a.m. on Tallahassee's only locally owned radio station, Real Talk 93.3.
Give us a minute and we'll make your day. It's the TOC Orthopedic Minute on the Greg Tish Show.
Sponsors half hour, as you just heard, Hearth and Patio. Anything fire they can do. We were out grilling yesterday afternoon. I was like, I am waiting on the weather to get better and to get out there and just to chill out around an amazing fireplace or outdoor or fire pit or custom kitchen, throw a grill in there or inside. Anything fire, Hearth and Patio can help you out with. Give them a call today, 850-727-4282. That's 850-727-4282 or online at hearthpatiotallahassee.com. TOC Minute!
TOC Minute!
We're doing like food.
I didn't realize we were doing the
No.
whole bit thing there.
Dr. Adam Almaguer. Almaguer. I said it right the first time.
You did. You had it right the first time. It's Almaguer, but I appreciate y'all having me this morning.
You're very welcome. Congratulations. You're starting. This is your second week at TOC.
This is the second week, so
and they're already throwing you into the fire with us.
They are, yeah. Okay. But I'm excited to be here. Get to mix it up a little bit. It's been a lot of years of training, doing the doctor stuff. So getting to get to hang out with you guys this morning is really exciting.
Oh, very cool. And I guess welcome home.
You
spent some time in Tallahassee with senior year of high school and then going to FSU. Go Noles.
Yes, sir.
All right. Tell everybody what you specialize in.
So I'm an orthopedic surgeon who specializes in joint reconstruction, specifically of the hip and knee, replacing those. And I also did my fellowship training in something called hip preservation.
Okay.
Essentially identifying those patients with conditions of the hip and trying to prevent them from developing early onset arthritis.
Now, I've got some issues with my right hip that I always have to pop it. That I'll be sitting down somewhere and it just doesn't seem to be relaxing enough, and I'll have to pop it into place, and then it's fine. Is that something that I should be worried about as I get even older?
So the funny thing about a hip that pops is there's actually two different types of causes that could be causing that. One is within the joint and one is outside of the joint.
This is within.
Within the joint. So if it's within the joint, the most common reason for that is a tear of the labrum. And the labrum is kind of an unusual structure for a lot of people, but the simplest way to think of it is the meniscus of the hip.
Okay.
So you have that cartilage within your knee, that's your meniscus, that helps with the cushioning. In the hip, you have a similar structure that's completely surrounds the hip joint, helps to keep the pressure in the hip normal. And as we age, it is pretty normal for a lot of folks to have tears in their labrum, but most of the time it's symptomatic. So as long as it's not causing you pain and not causing developing arthritis, it's something that I would just keep an eye on and not worry a whole lot about.
It's just something that's more annoying than anything. And it's just like I just need to feel like I need to stretch. And then once I finally hear, it's not like a loud pop, but once I hear that pop, then it's fine.
Right. And yeah, that's just something I'd keep a close eye on. As long as it's not causing you more symptoms like pain and discomfort, then you're going to be perfectly fine and not have to worry about it.
Now, my dad's mother, her biggest fear in life was breaking her hip and not being able to go and walk, and she did it. But she went through everything. I think she was at TOC and did the rehab, and she was up and at 'em in no time. This was 20 years ago. I can't imagine how technology has probably, because that seems to be with a lot of older folks that their big thing is breaking a hip. That seems like once you do that, you're done.
Yeah, so you're right about that. It's us as humans, to live, we got to keep moving. And when someone breaks their hip, that's something that's a big setback for them. Fortunately, the implants alone have come a long way in the last 20 years. But even more so than that, the techniques of how we take care of patients with hip fractures and specifically the approaches really help patients to recover much more quickly. So a lot of the guys at TOC have transitioned over to doing their total hips through the front, so the anterior approach. And the reason why that helps patients recover so much more quickly is because it's a minimally invasive, muscle-sparing approach, meaning we just go in between the muscles. We don't detach anything like we used to in the old days from the back of the hip. And by leaving the muscles alone, patients rehab so much quicker. And you're right, just like your mom did really well in the recovery phase, a lot of patients after a hip replacement by a week or two are really feeling well.
A week or two?
It's a pretty quick thing, yeah. So
wow.
Obviously I'm biased. I take care of folks with hips, but hip replacement's probably the best surgery we do as orthopedic surgeons, and people do extremely well.
Now, has anything like with knees or with hips, anything and I see something about 3D printing.
Yeah. So 3D printing, it's one of those new technologies, in particular for the knee replacements. So there's a lot of cool.
That's crazy. That's just wild.
Yes, there's a lot of cool, innovative ways that people are doing knee replacements, whether that's robotics or these 3D printed patient-specific guides to help us do the surgery. And myself, I tend to do the 3D printed guides. The way that works is you actually get a CT scan before the surgery. The company will then print 3D models of your bony anatomy and then make these custom guides that fit you and only you, so that we can do a customized knee replacement. And that's also very different from the old ways where we used to just give everyone the same cuts, the same alignment of a knee replacement. Now with this technology, the robot and the 3D printed guides, everyone gets a customized patient-specific implant, which helps them with a much more natural feeling knee.
Because I mean, with 3D printing, I've got a good friend of mine. He makes lightsabers.
Yeah.
You know, I mean, but then to hear that, you know, from Joey making lightsabers in Detroit to y'all doing it with knee guides. I mean, that's
It's surreal. It's like having an orthotic for your knee. It's like specifically designed just for the way that you walk, and it's probably the best thing that you could get as an alternative.
Absolutely.
That's awesome.
Yeah, and that's the thing why it's so important for knees in particular is hips, it's a ball and socket. It's a relatively simple joint. Knees are complicated, and with knee replacements, even though the majority of patients do well, historically about 20% just aren't happy for whatever reason. So by making these more customizable knee replacements into the patient's alignment, we're finding that a lot of these patients who came back saying, I'm just not satisfied with how it feels, a lot less of them are actually starting to show up, and people are much more happy with it.
Oh, I can imagine. I mean, just the comfort level. I mean, this is designed for you, and it is you. And instead of just saying, all right, here's your generic version.
Right.
And then, you know, your small, medium, large before. Now it's like, all right, we're scanning this or 3D printing. What a time to be alive.
It's exciting.
I mean, I can't, just with the technological advances, like I said, that was my grandmother's biggest fear was breaking her hip, and then that life was done. And now you're saying, you know, 1 to 2 weeks?
Yeah.
That's crazy.
Absolutely.
That's so awesome, too.
Got to keep people moving.
Yeah. Well, one of the things, all right, so with knees, I have bad knees. Matt, how your knees, I'm assuming?
I've got really weird knees because my knees will pop. Like, remember, like 2 years ago, I had my knee go out, and it was because the ligaments, I've got sort of a genetic thing where the ligament doesn't lay properly in the chamber, and it'll pop out. And then when that happens, I have to lay down and physically kick it back in.
Yeah.
But I didn't catch it in time, and it swole up. And as a result, I couldn't put it back in for like 2 weeks.
Oh,
what are things that we can do to, you know, if we're having issues with our knees? I mean, I talked about my hip, and now I have that, but also with this one bad knee. But what are some of the things that everybody out there can kind of do to help them, you know, keep these a little longer?
Right. So the first thing is, right, a lot of people you don't want to come see us. You don't want to come to the doctor. And I totally understand that. And that's fair. So the things to keep you away from having to come see us for knees in particular is, just like we mentioned, staying active. As you're moving your knee and those joints are gliding over top of one another, your body's producing the fluid in your knee to help glide smoothly. Some of the exercises in particular that are best for knees to prevent arthritis are things that really don't cause the constant pounding, like when you're running or going for long walks.
Right.
So whether it's swimming, elliptical, using a bike, those are the things that'll help those joints keep moving, keep lubricated without that wear and tear.
Oh, that's fantastic. Yeah, because I do walks a lot. I mean, not as much as I did last year, but or in the last few months, but obviously because it's hot out there. Go ahead, Matt.
This is actually an interesting question because I've been doing exercise off and on, and a lot of the different things that I do are sort of low impact. The one way that I've always lost weight the best is by running, but that's such a high impact sport for someone of my size. Is there any sort of things that people can do to sort of mitigate some of those extra factors that may be hitting on your hips, on your knees, things like that?
With
in
weight?
Regards, in regards to weight, because I'm sure I'm not the only one over here who has a little bit of a chunky chunk going on.
Right.
So.
Yeah, so there's several things you could do. I think the most important thing that oftentimes could be overlooked is our orthotics, the shoes that we wear on our feet. So choosing a shoe that's right for you is difficult. And honestly, someone who specialized in doing that, not even myself as orthopedic surgeon, but those folks who are trained at the stores or a podiatrist or someone who can help really to sort out what your alignment of your foot and ankle is, to choose a shoe that actually is going to help best suit you is something that's very important. The other thing is also, one, keeping up strength, but also thinking about your form. So when you're doing those activities, making sure that you're not getting sloppy and you're not just getting exhausted. Right.
Watch your gait and your ROM.
Make sure your mechanics stay well aligned, because it's once you fall out of normal alignments, it's not only when you're going to develop arthritis, but when you're going to potentially get yourself injured.
Well, Adam, man, it was great. I told you it was going to be good morning, goodbye. So it's so great to meet you. Thank you so much for coming in this morning. Oh, and Matt, good song.
You like that?
You get it?
I do. I like it.
Enjoy the day.
All right. Take care.
All right.